Buenas tardes a todos. Buenas tardes, buenas tardes. Ladies and gentlemen, Your Excellencies, distinguished guests, ladies and gentlemen, welcome. Welcome back. I wish you a warm welcome to this third plenary session of Gavi's Global Vaccine Impact Conference, and I'm sure you're all feeling refreshed after seeing the exhibition and inspired. Do try, ladies and gentlemen, the 360 video outside. Now, before I introduce you to our impressive panel of speakers who are ready there to come in, I'd like to share some context for this session focused on the power of the Vaccine Alliance. Now, as you know, the Alliance was created to bring together the expertise of all partners in immunization so that the Alliance can deliver more than each agency could do if they were to go it alone. So countries are in the driving seat. Gavi, the WHO, UNICEF, the World Bank, and the Bill and Melinda Gates Foundation are core partners. Donor governments provide essential resources. Civil society, private sector, and academia all play essential roles within the partnership. Now, we've already heard about the progress that's been achieved, and we've seen how this model has been stress-tested, incredibly stress-tested through the pandemic. And now we want to ask this diverse panel to really talk to us about what's needed now in order to meet Gavi's 2025 targets and deliver for generation immunity as an alliance. Ladies and gentlemen, it gives me great pleasure now to introduce our distinguished panel. First of all, His Excellency Dr. Pierre Somsé, Minister of Health and Population of the Central African Republic. Your Excellency, welcome. Bienvenue au front. Merci. His Excellency Gilbert Mokoki, Minister of Health for the Republic of Congo. Next, we have the Deputy Minister, Bjørg Sandkjær, for the Development Cooperation at the Norwegian Ministry of Foreign Affairs. Welcome to you. Mr. Antón Leis García, Director of the Spanish Agency for International Cooperation and Development, who will make his interventions in Spanish. Welcome to you. Bienvenido. And Dr. Endie Wazari, who, in addition to her position as National Coordinator of the National Stop Transmission of Polio Program at AFENET, is also the chair of the Gavi SCO Steering Committee. Welcome to you from Nigeria. And next we have Dr. Ephrem Lemango, Chief of Immunization at UNICEF. Welcome to you. And we also have a very special guest here in the front row who will join us later on stage at the end of the session for his closing remarks, Dr. Bruce Aylward, and he is the Assistant Director General for Universal Health Coverage and Life Course at the World Health Organization. Welcome, bienvenido. Merci beaucoup. Gracias. Okay, right. Ladies and gentlemen, we are going to start. Now, I am going to put our first question. I want to start with a question first to you, Dr. Wazari. We know what an evolving country needs, and you are seeing this in Nigeria. Tell us how your organization, AFENET, is working with the Alliance right now to respond to these needs.
Thank you very much for the question, and I'm happy to be here this evening. Just to give a little background about Nigeria, first of all. So we all know that Nigeria is the most populous country in Africa. And then we, in the same light, contribute the second highest number of zero-dose children in the world. So we have about over 2 million children that are zero-dose, haven't received any vaccination in their lifetime.
Can you just say that once again, because that's incredible. 2 million children with zero dose. 2 million children that haven't received a single vaccination
in their lifetime. So it's good to have those numbers. Over time, we've seen an improvement in our DPT coverage from 33% in 2016 to about 56% in 2021, despite the pandemic. But then, because of our huge population, 56% is very suboptimal. So we have a huge number of children that haven't received any vaccination, and because of that, we have continued outbreaks of vaccine-preventable diseases. But good to note is the outbreak of the circulating vaccine-derived polio virus, which is an indication of poor routine immunization. So because of that, the government has put in a lot of efforts in trying to reach these zero-dose children and the missed communities. Recently, we prioritized 100 districts in Nigeria. We call them local government areas. These are the districts with the highest number of unimmunized children, and we've drawn up strategic interventions to reach those children. For my organization, we've worked on polio eradication for the past maybe 14, 15 years, supporting efforts of Nigeria in trying to eradicate polio, and we were very, very key to the success that we recorded in 2018, 2019, when Nigeria was, and 2020, when Nigeria was declared wild polio virus free. We were able to reach places that hadn't been previously reached before then, with polio vaccine reaching children. But also good to mention that, so that polio effort is funded by the US CDC. But we are also working with Gavi to implement the zero-dose learning hub, which is an initiative that is geared towards synthesizing lessons that we have learned over time, knowing strategies that work, strategies that wouldn't work, knowing what to scale up and what not to scale up, what to leave out, but importantly, documenting those processes so that we can learn and we can share experiences with a global world. So we're working with the Alliance to do that, and that's just something we started. It's at the implementation. We're just starting, right? So it hasn't really been fully rolled out. We're in the first phase of that, of the implementing the zero-dose project in Nigeria. And, we're also trying to set up a knowledge management system. And knowledge means, like I said, knowing what works, knowing what doesn't work. So learning and unlearning, and knowing what to do, what strategies and approaches to take forward. Thank you.
Fantastic. Thank you so much. Really great to hear what's happening there in Nigeria. Ladies and gentlemen, I would like to introduce a very special speaker that has arrived now, and it gives me great pleasure to introduce His Excellency Gilbert Mokoki, Minister of Health for the Republic of Congo. Welcome, Monsieur. Bienvenue, bienvenue, bienvenue. If you'd like to take your seat. Thank you so much. Right, I will continue. Thank you so much. I want to ask you, Your Excellency, about the experience in the Central African Republic, and we're acknowledging, of course, the devastating conflict which is impacting the delivery of vaccines in the Central African Republic. Tell us, how has the Alliance contributed and coordinated with the Ministry of health in the past, and what needs to be done to continue to promote access to vaccines?
Je dois d'abord remercier le partenariat Gavi, qui est un partenariat, je veux dire, exemplaire. J'ai été nommé ministre en 2017, un an après donc la mise en place d'un gouvernement démocratique. Et à ce moment, la couverture vaccinale était de moins de 50%. Et 80% du pays était occupé par des rebelles. Et l'accès à ces parties du pays qui sont occupées était extrêmement difficile, presque impossible. Oui. Et je crois que la première chose à retenir avec ce partenariat, c'est vraiment l'empathie et la volonté de sauver et une bonne collaboration, un travail d'équipe. On a travaillé avec l'équipe de Gavi comme une seule équipe, déjà. Et ça, c'est déjà un facteur extrêmement important. Et donc, c'est dans cet esprit que nous avons organisé un forum national sur la vaccination qui a rassemblé tous les acteurs, y compris les groupes armés, pour arriver à un plan de relance de la vaccination.
Y compris les
groupes armés. Oui.
Incroyable.
Oui, pour arriver à un plan de relance de la vaccination. Donc, c'est pour dire ici, en passant, que pour nous, la vaccination a été un facteur de paix. Parce que c'est grâce à la vaccination, notamment contre la polio, que nous avons, en négociant avec les groupes armés, ouvert donc, des corridors. Et finalement, rapprocher ces groupes armés du gouvernement. Et donc, et ça, c'est des choses qu'on ne dit pas, qu'on ne mesure pas. Mais on ne peut pas mesurer le coût de la paix. L'argent investi dans la vaccination génère ce type de changement qui n'a pas de coût, qu'on ne peut pas estimer. Et souvent, on ne le met pas dans nos calculs. Ça, c'est déjà quelque chose d'important. Et grâce à cela, nous avons été admis, comme tous les pays qui sont en paix, au statut de pays sans polio, en 2020. Vous voyez? Et grâce à ce plan de relance, nous avons été prêts pour gérer la crise de Covid, qui donc a apporté beaucoup d'appui avec la coordination des partenaires de Gavi, de l'UNICEF dans le domaine du supply, de l'OMS dans le domaine de l'appui technique. Et on a amélioré la coordination parce que Gavi a été pionnier pour apporter amener une approche coordonnée de tous les partenaires. Par exemple, de la Banque mondiale, de l'UNICEF, une mission conjointe a eu lieu en République centrafricaine, dans le cadre de l'amélioration des investissements dans le cadre de la vaccination. Et ça, c'est sur l'initiative de Gavi. Et il y a également le fait que dans le cadre de la lutte contre le Covid, grâce à l'appui de l'OMS et de Gavi, on a engagé une approche communautaire dans un système de santé dévasté. La seule chance que nous avions, c'était la communauté. Seule la communauté pouvait gérer la crise. Et grâce à cet engagement de la communauté, avec la surveillance assise communautaire qui nous a permis de dépister à la fois les personnes vulnérables avec comorbidité, mais aussi les enfants. Les enfants, zéro dose, les enfants, et on n'a pas arrêté la campagne vaccinale. Pendant la crise Covid, nous n'avons pas arrêté de vacciner les enfants. Par contre, on a combiné le dépistage, la prise en charge au niveau communautaire avec la recherche des femmes enceintes, avec la recherche des enfants non vaccinés et leur rattrapage. Ce qui est important aussi de dire, c'est vraiment le rôle des organisations humanitaires. Comme j'ai dit ici que la vaccination était un facteur de paix. Mais c'est grâce aux organisations humanitaires, aux agences des Nations Unies comme la mission de maintien de la paix. Parce qu'il y a des endroits inaccessibles. Il n'y a que l'avion pour y aller. Et certains humanitaires comme la Croix-Rouge, la Fédération internationale de la Croix-Rouge et de Croissant-Rouge, MSF par exemple, a aidé à transporter les vaccins dans des endroits où il n'y a que MSF pour aller. Donc c'était alors la force du partenariat. Donc ce partenariat a généré sur le terrain un partenariat plus large pour la vaccination. Et je pense que le parfait est l'ennemi du bien. Il y a toujours des problèmes, mais on est dans le cadre où on cherche à faire plus et mieux. Et je dirais que dans ce cadre de collaboration, ce qu'il faut faire mieux, c'est que l'engagement du partenariat pour les pays en crise doit être plus franc. Par exemple, dans ce forum, je n'ai pas vu une session spéciale pour les pays en crise. Mais on ne choisit pas d'avoir la guerre chez soi. Tous ici, on a un peu de crise chez soi. Mais dans ce forum, il n'y a pas un moment dédié aux enfants qui souffrent aujourd'hui dans les zones de guerre, dans les zones de crise. Et ça montre très bien que dans le travail de Gavi, bien sûr, on nous appuie, mais ce n'est pas avec une focalisation sur la spécificité de ces enfants. Et moi, je le ressens sur le terrain, parce que je pense que moi, l'appui que Gavi me donne ne prend pas totalement en compte mes conditions, les conditions des enfants qui sont là-bas. J'ai des besoins, etc. Donc je crois qu'il faut qu'au niveau de la vision, que cette approche des enfants vulnérables, dans des endroits en crise, soit vraiment prise en compte. Aujourd'hui, je crois qu'un de mes collègues a parlé du Soudan. Aujourd'hui, on a envahi les pays frontaliers du Soudan par des réfugiés qui arrivent. Et beaucoup d'enfants arrivent non vaccinés. Mais je n'ai pas vu de réponse de Gavi par rapport à cette crise. Je n'ai pas vu ça. Certainement qu'on le fait à travers les ONG, etc. Mais politiquement, c'est important. C'est important de faire preuve de préoccupation, d'empathie, de façon spécifique. Je crois que ma collègue de l'Ouganda a soulevé cette question un peu avant. Je crois qu'il faut effectivement que Gavi continue de nous aider à amener les partenaires à mieux se coordonner. Je vous ai parlé ici des difficultés que j'ai eues dans le domaine de l'intégration de la campagne polio et la campagne de vaccination. Certains partenaires avaient peur que l'intégration va tuer la vaccination et que la couverture va tomber, ce qui n'est pas le cas. Okay. On a des raisons, je ne peux pas tout expliquer ici. Mais il faut qu'on s'écoute. Comme je l'ai dit, je le répète encore, les partenaires de Gavi, les donateurs doivent comprendre que sur le terrain, on a une sagesse locale. Il n'y a pas que les idées globales qu'on a. Okay. Mais pour que ces idées globales marchent, nous, on a la sagesse locale. Et même moi, en tant que ministre, je ne connais pas encore très bien le village. Mais dans le village, il y a des gens qui ont des sagesses locales et qui vont faire marcher les choses. Il faut faire confiance.
Merci.
Il y a aussi ce que je vois comme la peur du risque. On ne veut pas prendre de risque. Parce qu'il y a le chaos là-bas. Mais il y a des humains là-bas. Okay. Et on parle d'enfants, il y a des enfants là-bas. Ces enfants, ils ne peuvent pas parler. Ils ne peuvent pas prendre le fusil. Mais ils comptent sur des gens comme les donateurs de Gavi, comme les partenaires de Gavi, pour lutter à leur place. Voilà ce que je peux dire pour le moment. Mais bien entendu, on est ici pour chercher à faire mieux. Ce n'est pas pour dire que ça ne marche pas, ça marche. Mais c'est pour vous donner des aspects où on peut faire mieux.
Merci beaucoup, ministre. Merci beaucoup. La vaccine. Les vaccinations sont un facteur de paix. Incroyable. Merci beaucoup pour votre mot. I want to continue and go now to the Republic of Congo. Monsieur le Ministre, I want to ask you, Your Excellency, Minister Mokoki, under the Alliance's banner of the big catch-up, what are your priorities right now for routine immunization programs in the Republic of Congo, and how can the Alliance best support you in meeting these objectives?
Merci, je voulais m'excuser pour le retard d'abord. Je voulais, en termes de jeu, remercier Gavi et les autorités de l'Espagne qui ont organisé cette conférence. Merci aussi d'avoir porté votre attention sur ma modeste personne et sur le pays surtout. Pour répondre à votre question, je voulais faire quelques rappels simplement d'abord que le Congo a conclu avec Gavi un programme de transition 2011-2017 sur la base du cofinancement. Et le Congo s'était engagé à financer à 100% sa quote-part. Et le Congo a acquis, avec ses propres ressources, tous les vaccins, sauf le VPI. Et cela a permis d'avoir une couverture vaccinale de 86%. Mais en 2014, survint la crise économique. Et qu'est-ce que cette crise économique a eu pour conséquence des difficultés au plan du financement de la quote-part du Congo pour l'achat des vaccins et aussi pour l'organisation des opérations de vaccination. Cela a eu pour conséquence une chute des performances. Donc nous sommes passés de 86% à 69% en 2017. La couverture vaccinale est tombée. Alors quelle était donc la réaction? La réaction du Congo, c'est qu'on a établi un plan pluriannuel complet de vaccination 2018-2022. Et ce plan a prévu la budgétisation de l'acquisition des vaccins par le mécanisme VII. Le Congo a conclu avec l'UNICEF un protocole d'accord pour un préfinancement de l'acquisition des vaccins et cela est soutenu par une lettre de garantie annuelle que le ministre des Finances à hauteur de 13 500 000 $ pour garantir que le Congo va payer et à partir de ce moment, l'UNICEF préfinancer. Ce mécanisme a permis donc d'améliorer la couverture vaccinale. On est parti de 69% à 75%. Ça a été vraiment un progrès. Mais survient la Covid-19. Comme la plupart des pays, notre système sanitaire a été éprouvé et on a focalisé notre attention sur la lutte contre la Covid. Donc on a perdu presque de vue la vaccination de routine. Ça a eu donc des conséquences qui ont permis, qui ont fait qu'il y a eu beaucoup d'enfants qui n'ont pas eu leur dose de vaccin, le Penta 11, le Penta 1 plutôt. Alors nous avons organisé donc une revue externe de couverture vaccinale. On a identifié qu'il y a 68 399 enfants concernés par 0 dose. Donc nous connaissons déjà la cible qu'il faut pour le rattrapage. À partir de ce moment-là, qu'est-ce qu'il faut faire? Quelles sont donc les priorités? Nous allons organiser un CCA avec les partenaires. Nous allons élaborer un plan de planification ascendant et concentrer nos efforts dans les zones identifiées. Ce sont les zones essentiellement périurbaines, Brazzaville et Pointe-Noire, mais aussi les départements du Nord où l'accessibilité est difficile. Mais nous ne pouvons pas aussi oublier là où il y a la performance. Il faut donc, parallèlement à cette action, maintenir la performance déjà acquise dans les zones où il y a un bon score. Alors, comment faire? Il faut disponibiliser, la première chose, c'est le vaccin. Et pour cela, nous maintenons la collaboration avec Gavi, nous maintenons la collaboration avec l'UNICEF. Je voulais ici remercier Gavi pour nous avoir aidés à acquérir une chaîne de froid qui permet de conserver les vaccins, et de l'échelon central et au niveau de la santé primaire. Alors donc, dans ces priorités, nous devons prendre en compte le maintien, l'entretien de cette chaîne de froid. D'où il faut former le personnel qui gère cette chaîne de froid, parce que nous avons eu à constater qu'il y avait quelques négligences. Peut-être pas des négligences, mais par ignorance, les gens ont péché. Alors, c'est une priorité pour nous. Il faut maintenir la collaboration avec Gavi pour que les personnels, on renforce les capacités au niveau de ces personnels. Mais il faut aussi renforcer la capacité des personnels au niveau de soins de santé primaires, parce que la vaccination ne doit pas être une activité d'exception. Ça doit être une activité normale des services de santé. Pour qu'on ne puisse pas souvent faire des campagnes de vaccination, il faut que les services de santé au niveau, à l'échelon primaire, puissent prendre connaissance, puissent maîtriser la vaccination. Voilà Et puis, j'allais oublier, il faut maintenir le dialogue communautaire. Il a dit tout à l'heure. Le dialogue communautaire est très important dans l'identification, dans les enfants qui sont oubliés, et aussi pour passer un message pour que les gens adhèrent à la vaccination. Parce que des fois, il y a des réticences. Voilà un peu ce que je voulais dire en ce qui concerne nos priorités.
Merci beaucoup, Ministre Mokoki. Thank you so much for talking to us about the experience there in the Republic of Congo. And now we go to Norway, and I'd like to ask the Deputy Minister, Sandkjær, to come in. And the idea of being a Gavi donor is more than just, signing a check, isn't it? Just tell us, how do you think donors could change and reinvent the way they support immunization through the Alliance?
No, thank you. And I was reflecting on the evolution of Gavi as I was listening to the previous speakers and the experience and the strong voices from the countries, which is really where the partnerships should be and are in many ways happening. Norway was a founding donor to Gavi around the turn of the millennium. We were all focused on the Millennium Development Goals, or at least what and the Millennium Development Goal on child mortality. Gavi has been an incredibly important tool, an alliance to help us make great progress. But we've also learned a lot through this collaboration that we need to bring into the discussions that we are having now. Because if you've been involved in these discussions for some time, they start to feel a bit familiar. We discuss how do we best organize ourselves at the global level, at the regional level, at the national, maybe even the community level, to be able to make that change in people's lives, and in this case, to get those needles into the arms of babies and other people who need them. But I do believe we are at a time now, post-COVID, where we have a chance to really do things differently. And there are a couple of initiatives that I think are very important. Norway is involved in strengthening the collaboration between Gavi, UNICEF, WHO, potentially CEPI, in producing an alliance from the global level to outreach to zero-dose children. Because we do need to improve that collaboration, and that's something that we've seen in the Gavi Alliance as well. We noted in the MTR report that we are here to launch that there are some challenges around successful transition, and co-financing, and so a topic that comes up also in any other discussion that I'm in on whichever intervention we're talking about is the question of financing and the question of how we better support country and regionally driven agendas. And I think that's where the heart of the matter really is. Now, the Gavi model is really set up to support countries' own priorities and plans. And that was quite a novel thing back when Gavi was set up. But I think there is a time now for us to revisit this and see how we can push and change Gavi as well as other global health initiatives and ourselves as direct donors to be true partners at country level and support country plans and country priorities. And there's one initiative I'd like to mention in that regard, which is co-led by Norway together with Kenya. It's called the Future of Global Health Initiatives. They haven't concluded yet, so we don't exactly know what they will recommend us to do, but it brings together global health stakeholders, governments, international and domestic financing partners, civil society, health organizations, and academics, consulting throughout 2023 to see if we can really now use, I think, the unique moment that we have to really build back better after the pandemic and be better partners to countries.
Thank you so much, Minister Sandkjær. Thank you so much. Great to hear what you've just said there. Now, we move to Spain. Thank you so much. We're very grateful to the Spanish government for welcoming us here in this beautiful city, Madrid. Muchísimas gracias. And Mr. Leis, we know that Spain has been involved with Gavi and the Alliance from the beginning with some fantastic collaboration efforts to support national routine immunization programs and the Alliance's mission at country level. How can the Alliance, would you say, foster better links between the international donor community and local partners, and how could the Spanish government support this?
Well, thank you very much. And let me say, I think my boss, the minister, yesterday welcomed you and say it is an honor and a privilege and a pleasure to have all of you here in Madrid. We hope you can enjoy the city. I think yesterday you visited the Reina Sofia Museum, but hopefully you will have some more time to enjoy this city. We are a big partner of Gavi. We've been from the beginning. There is, of course, the check that you mentioned, about 300 million euros in funding, and the involvement of not just the government or the development agency, AECID, but also the private sector. And La Caixa plays a fundamental role here, also other organizations, is global, others. We provided more than 60 million doses of vaccines, COVID-19 vaccines through COVAX. We were the 5th largest donor. And in the area of vaccine and immunization, Spain has always been active. And we have some best practices, actually, if you think of one of the most promising vaccines on tackling malaria, which is a disease of the global south. It is actually the product of a Spanish-Mozambican collaboration, through the center in Manisa that we've been supporting from 1996. So the midterm review is a moment of reflecting. It's a moment of thinking, strategizing, taking stock. And frankly, in response to your question, I have mixed feelings. On the one hand, a sense of pride and accomplishment that we see as ours, as partners of Gavi, of what we've been able to achieve, close to 1 billion vaccinating children in the world. That's truly amazing. The response to COVID-19, new vaccines, HPV, rotavirus, 3 million deaths through COVAX that were prevented. The economic impact, and I think this is very important. It is important to mention that this is not just a matter of solidarity. It's also a matter of interest, economic interest as well. Vaccinating children is an investment. It's not an expenditure. And we're thinking of, the objective of 80 to 100 billion in economic impact. But we are in a world of crisis, and if you look at how we are doing on the SDGs, including, of course, SDG 3, we're falling short. If we continue current trends, there is going to be 600 million people in poverty more than we see today. Gender equality, which is very important, and is an agenda that is also close to the Gavi's heart when it comes to the HPV vaccine, for instance. It will take us 286 years to close gender gaps if we proceed at the current rate. And when it comes to vaccination and to the targets on SDG 3, we are making very slow progress, including in middle-income countries and regions like Latin America, where you see inequity growing. It's not just a matter of absolute numbers, but also how to reach those children that are often in rural communities affected by conflict. So what can Gavi do? Well, first of all, I think we need to take note of what our partners from the Republic of Congo and the Central African Republic has told us. We need to put the countries and we need to put the communities in the driving seat. This is very important. They know best. And I think this has been embodied in the Gavi concept from the very beginning. They set the plans. We support. They are in the driving seat. We're accompanying. We're playing a role. We're funding. We're supporting. But they're in the driving seat. And this unique focus on impact partnerships with the private sector, and believe me, we work in other sectors as well, food security, other sectors. This is a best case example of how we can involve partners beyond traditional donors, governments, and so on. The focus on innovation and the focus on systems, very important, on how to achieve universal health coverage. Immunization is actually the first, the entry point into the health system. The first time any of us goes to the doctor is probably to get one of our early vaccines in life. It is easier to come a second and a third time, and it's absolutely crucial and important. What can Spain do, and what have we been doing at the national level? Well, first of all, we need to support Gavi and others to keep the momentum on global health. There may be a tendency, there are other crises now at the moment, I don't need to mention them by name, food insecurity and so on, but we need to learn the lessons of the pandemic, and we need to understand that these challenges are truly global, that they affect disproportionately the global south, but until everyone is safe on any of these health challenges that we are trying to address through immunization, nobody will be safe. What is Spain doing? We just adopted a new law on cooperation for sustainable development and global solidarity, which is a change in the paradigm. We need to focus or to move from aid to partnership. And I think that's the word that I heard in French and English in this conversation the most, partnership. And we are talking about global public goods. poverty is our worst enemy. And when we look at these zero-dose children, that's not a failure of health systems only. It is a failure of states, societies, the international community. Conflict is indeed very important. We need to address all these issues. But global public goods, including global health, is, of course, very important. What are we doing? We are acting multilaterally, and we are, Gavi is one of our top channels to deliver this support. But we need to work bilaterally with national health systems, with national health ministries. We launched 2 years ago a new global health program. It's already 10 million that we have channeled through grants, focused on health workers, on health facilities. We have a program for many years on medical specialties where we put in touch Spanish doctors and Spanish health professionals with professionals from countries like Mauritania, Ethiopia, Bolivia, or Paraguay. So they learn from one another, and actually they build solid partnerships, human partnerships that go actually in life. We're working on infrastructure in Honduras. We're working on the construction of hospitals, on rebuilding infrastructure after the pandemic. So I would say what we need to do, like as donors, is of course funding. We need to be there, and we have competing demands. Let's be clear, multifaceted crisis. We need to be everywhere, but we need to be in global health, and we need to be in immunization. But perhaps most importantly, and you mentioned this at the beginning, Maria, is also the political support, the public opinions, and to treat this not as an expenditure, as an investment in a safer, more prosperous planet, not just for the communities in the Central African Republic and in Congo, but also people in Spain, in Norway, and everywhere in the world.
Thank you so much. Thank you, Mr. Leis. Right, I want to go now to UNICEF and bringing Dr. Lemango. I just want to ask you, how can the Alliance partners continue to support countries to deliver on targets for the remainder of this strategic period?
Thank you very much. Good afternoon, colleagues. And thank you very much, Antón, for that tour yesterday we had at the museum. Quite an immersive one. It was my first time having a private guided tour, and we want to do it again and again. Wonderful one. It was quite immersive. For some of you who haven't went yesterday, please do your best to go. And back to the question, as an alliance, we are celebrating a very critical success, quite an impact, 1 billion children reached so far. But we are also celebrating this success while recognizing what remains ahead. And as a core partner to the alliance, we have been quite vocal in talking about the need to reach children that are missed during the pandemic. Some of you may have seen our State of the World Children report released by UNICEF, but organized by all partners, that talks about 3 major things. Number 1, we are at a critical point whereby between 2019 and 2021, due to disruptions by the pandemic and many other pre-existing conditions, we have close to 67 million children that are missed or that are missing 1 or more vaccines from their routine immunization. And this is across several countries, but some 75% of them are in top 20 countries. And it is very urgent for us to really act on this important remaining agenda. The second issue is that we are seeing across several countries a volatility and decline in vaccine confidence. And the future of vaccines can only be assured when we are able to understand the vaccine hesitance causes and be able to fill in this information gap and be able to put systems that are able to understand what communities need and engage accordingly. And this is not only a developing country or a middle-income country issue that we are seeing in every country, low-income country included. We see vaccine confidence challenge, even though what lies behind it varies from country to country. The third thing we're saying in this report is that access challenges still remain, and reaching the last child still remains quite difficult due to inequity, especially in conflict-affected settings in countries where there is fragility, that we have to do things differently, and heavily driven by gender and some of the critical factors that underline access to services. That is why we called on, as partners together, for the big catch-up. A very important moment, and we need to catch up not tomorrow, but today. We need to catch up before it is too late, given that a child that is missed out of vaccination today is likely to be impacted by a measles outbreak tomorrow and go through the suffering and perhaps unfortunate cases. That is where we're calling on all governments, and it's an appeal to governments to take this quite seriously. One, to catch up on children that were missed during the pandemic, not necessarily due to the pandemic, but at least pandemic and non-pandemic pre-existing conditions. Two, the other part of catch-up is to restore services that were disrupted by the pandemic so that we'll be able to continue to reach children that are missed at this very moment. And finally is to make sure that we make the required investment to strengthen systems so that we'll be able to reach those zero-dose children. And most prominently, community health workers and primary healthcare investment features quite heavily. The greatest thing is in 2022, we are seeing recovery signs, but there remains so much to be done. And ahead of the 50th year celebration of EPI next year, we hope to come back to celebrate positively after reaching all these children. Thank you so much.
Thank you so much, Dr. Lemango from UNICEF. Now, ladies and gentlemen, we have a special announcement. And for this, I would like to welcome to the stage Dr. Kokra Asua from Integrate Health. Dr. Asua, please make your way to the stage. The floor is yours.
Thank you very much. My name is Kokra Asua. I am the Senior Director of Monitoring, Evaluation, and Quality Improvement at Integrate Health. I am a member of the Global Support Team of Integrate Health based in Zurich, in Switzerland. Integrate Health is a non-profit organization that has been building innovative healthcare solutions for nearly 20 years in Togo by partnering with local communities and ministries of health to make quality primary healthcare accessible to all. The key of our programming is engaging community members and specifically community health workers from program design to implementation. We use an integrated primary care approach to improve community health outcomes. Our proven approach has led to a 30% decline in under 5 mortality over a 5-year period and has shown the effectiveness of working collaboratively with ministries of health. Due to the success of our approach in Togo, the Guinean Ministry of Health invited Integrate Health to join them in filling critical gaps in the implementation of their community health strategy with a particular focus on zero-dose children in remote areas. We are thrilled that Gavi is committing to support Integrate Health's innovative approach to put even more resources behind our partnership. Integrate Health, Gavi, and Guinea's Ministry of Health are partnering together over 3 years to implement an integrated primary care program with an emphasis on vaccines in the Kurusa district, serving a population of 112,000 while sharing and replicating lessons learned nationwide. Gavi has invested $3 million in this endeavor, and $3 million in matching funds have been secured through Integrate Health's valued partners, bringing this investment to a total of $6 million over a 3-year long pilot project. Guinea's Ministry of Health is a key partner in this collaboration. Our work and our objectives are being guided by Guinea's existing policies toward improving community health in the country. Through implementing our strategy with Guinea's already existing professional community relays, the so-called relais communautaire, and the community health workers, we hope to improve health outcomes from within. Our goal throughout the project period is to continuously learn, evaluate, share our successes and challenges as we work to implement and scale this community-centered approach. Integrate Health is grateful for the opportunity that Gavi's private sector matching mechanism has given to diversify and strengthen our funding for this important project. As we enter into this existing phase as an organization, Integrate Health will work diligently with Gavi and Guinea's Ministry of Health to honor the patients we serve. Vaccine equity is a public health necessity, and it is very much possible. Through this collaboration between Integrate Health and Gavi, we will improve health outcomes for families across Guinea. Thank you for your time. Thank you, Gavi, for your work to improve the health of people around the world.
Thank you so much, Dr. Kokra-Asua from Integrate Health. Thank you. Fantastic to hear from you. All right, ladies and gentlemen, we now come to the end of our session. And for that, I would like now to invite our special guest, another special guest, the Assistant Director for Universal Health Coverage and Life Course at the World Health Organization, Dr. Bruce Elwood, to share some closing reflections. Dr. Elwood, the floor is yours.
Thank you very much, Maria, and thank you, everyone. I'm going to ask a rhetorical question. You don't have to answer it, but I am interested in the show of hands. How many people understood the title of this session? Through the Looking Glass. Okay, we've got one brave soul, and I promised I wouldn't ask. So, folks, Through the Looking Glass, of course, this is a fantastic novel. It's 150 years old, and it had a really important theme. Ellis went through the looking glass, and the whole idea was you can learn from the past, but you can't change it. And we are now, through this panel, learning from the past as we look forward. And why is this so important? Well, we've talked about today the staggering impact that this alliance has had. A billion children reached, huge impact on the markets, brought the prices down, huge government commitments now with financing, and the list goes on. And we weren't able to really dig into this. Everyone talks about the power of partnership, but you can only really dig into the power of a partnership and alliance by hearing from the diverse voices like we've heard today, from civil society, from our core partners, from our donor partners, but most of all, importantly, crucially, from governments, because indeed this partnership is not successful unless governments feel it's successful and the communities that they serve. I do want to highlight and apologize that we don't have up on stage the absolutely other crucial part of this fantastic alliance. There are many other parts, but industry isn't sitting up here. And of course, without the products that you make and you continue to innovate on, we wouldn't have been able to celebrate what we did this morning. So what do we hear in the reflections? I take away 4 things. The importance, number 1, of being aligned behind governments, behind a government plan, and the power of that. The second thing is leveraging the partnership. Everybody has strengths. We need all of these strengths contributing to. We heard, I'm not going to go through them all, but the power of all the strengths. Starting, I do want to single out, though, Endie, where you started. Without the communities and that ingenuity about reaching the zero-dose children, we're not going to get there. We heard about that. We heard as well the crucial importance of innovation, and not just innovation to overcome the challenges as they evolve, but also of risk-taking, as you highlighted, Minister, the importance of taking risk. And you mentioned, Deputy Minister Bjørg, that things are getting very familiar, which means, you know what, we may not be taking enough risk, and that is a problem as we look forward. The last thing that we heard, though, was adaptation and being adaptive. And we have got to be able to adapt. The world is changing, the challenges are changing, the environments are changing, and it's been that alignment, the leveraging, the innovation, the adaptation that has been so powerful. And I think we heard fantastic examples of all of those today. And it is so important, and this comes to the other part of the looking glass. When Ellis went through the looking glass, what happened to her world? Someone has to have read the book. Okay, it's 150 years old. Her world turned upside down. And at the end of the book, she wakes up and the world turns right side up again. She wonders, did this even happen? And for us, of course, and for the ministers, for societies, for every single person on this planet, our world turned upside down over the last 2-3 years. And that is when we really saw the power of this alliance, because it could move so fast to create COVAX, to empower COVAX, to expand COVAX, get into spaces we hadn't been in before. Extremely impressive. Because this is where the similarities to the looking glass, through the looking glass, end. Because we aren't going to wake up. Our world has been turned upside down, and it's going to stay a little bit upside down compared to when Gavi started. And this is because we have climate change in front of us, and it's going in one direction right now. Our world is changing. We have, in the near term, of course, conflicts that are challenging us everywhere, as the minister laid out. We have got also, of course, the economic crisis right in front of us, and Bjørg, you mentioned it, others alluded to it as well. In front of that, we have to finish the 5.1 agenda, which is so important. The catch-up campaign, the catch-up initiative that you spoke to, Ephrem, it's crucial. We talk about the numbers, there's X million missing children. The reality is 50,000 will die if we don't catch up. That's a hard number, we know. We have got to catch up. We know how to do it. This is just the will to move that part. We've got to get HPV expanded to save a lot of those lives. We've got to introduce malaria vaccine, a fabulous opportunity. And we've got to integrate the COVID vaccine. These are huge things to do in a 2-year, 24-month period, but there is absolutely no doubt, listening to a group like this, that this is achievable. And that's very, very exciting. And then, of course, we've got Gavi 6.0 as we look forward, and I'm already looking forward. We won't get through that next 24 months without the support of everyone here. We won't get into 6.0 and build on all the great opportunity in front of us, which, as Seth laid out this morning, vaccine science has changed. There's fabulous new products coming down the pipeline. But as you've highlighted, Ephrem and others, communities are a little bit confused right now about vaccination. We've got to solve that part of it. And this is where people like you, Miriam, are going to be so important from the platforms that you stand on. But I think it's been a fantastic session. We've heard, again, not just the power of partnership, but we've heard what makes it work. Alignment, leveraging everybody in a coordinated way at all levels, ensuring that we continue to innovate, ensuring that we continue to adapt. Because the world has changed, the challenges have changed, but the importance of this alliance hasn't. This alliance is more important than ever as we go forward, because in that challenging environment, the other thing we've heard from the ministers, we need a strong primary health care system as we go forward. We need a workforce as we go forward. And this, in reality, is going to be our biggest challenge as the Gavi Alliance. How do we, as the foundation of primary health care systems, ensure that those foundational elements, not just financing, but the workforce, are in place to make the gains we've made not just sustainable, but resilient to the shocks we'll continue to face as we go forward. It's been a fantastic session. I think at the halfway point in our 2 days, I've learned a lot. I'm sure everybody else here has. But the biggest thing we've learned is the power of this partnership is not accidental. It's because of what everybody brings to it, how we work together. And be assured, I should put the pitch. I have to commit my own organization. WHO was all in from the beginning, and we're all in through the lifespan of Gavi, just like we were in COVAX, just like we are along that value chain. So thank you very much for the chance to reflect myself.
Thank you so much. Thank you, thank you, thank you. Dr. Bruce Aylward from the WHO. What a fantastic way to close there. I'd like you, ladies and gentlemen, to join me in thanking my distinguished panel. Thank you all so much. And we now have a 30-minute break. But before we go to that break, thank you, our audience. Ladies and gentlemen, thank you.